Hi everyone, it's Aileen here. I'm one of the nurses from the Irish Heart Foundation and thanks for listening in today. Today I am joined by Maher, and Kathy is a pharmacist. She works in the community. She works out of Duleek in County Meath. So she's the pharmacist that you would bring your prescription from the doctor to and they would fill it in the pharmacy for you. We get lots of questions on the pages and from lots of our members in relation to medication, because I think a lot of the time people have had an acute cardiac or brain event, so a stroke or a heart attack or something else. They're not used to taking medications, and now suddenly they might be on a great list of medications, and that can lead to a lot of questions around managing those medications and worries around those medications. So in this chat today, we're going to talk about the management of your medications. So Kathy, welcome and thanks for joining us.
Thanks for the invitation, Aileen.
So we'll dive right in. We've gotten lots of questions in from our members. So we'll go through those one by one. And if you want to kind of elaborate on anything or go down another path, you just let me know, Kathy. So the first question that came in was a very kind of obvious one. And I think one that most people meet is that what I've just alluded to. They were on nothing before. So medications were not part of their day. And now they have to take 7 medications in the morning. There's a couple in the middle of the day, and then there's a couple at night. And this lady in particular felt very confused about, God, how do I manage this? So do you have any tips on how she could manage that, Kathy?
Absolutely. When we have a situation like this where someone is just thrown nearly into a health system that they need to learn to manage, need to learn to navigate, a condition now that they need to educate themselves about, and now have medicines they're not really sure what to do with. So we want to really make sure that people are understanding their medicines. First of all, I would ask them to try and find out why they're taking a particular medicine. And in pharmacy, we try to sit down with patients and say, right, okay, here is a beta blocker. What are we going to use this for? Here's your aspirin. What are we using this for? And very often on the label of a medicine, I would put aspirin, antiplatelet for blood clotting or whatever it is. So sometimes people go, actually, I know what that's for. So I know what each medicine, what the name is, what it's for, the dose I need to take, why I'm taking it, and how I take it. And they're just the basics. And once we understand all of that, it's much easier to say, right, how can I take this as prescribed? So the right dose, the right time, the right person. So with that, so a patient who's taken medicines multiple times a day, they may need to invest in a little medicines dose tray. So they're really simple things that you can buy in a pharmacy. Just you can fill it up every week, you might fill it up every month. And if you're unsure, maybe perhaps a relative can fill it up for you. You can sit down, you can put in your morning, your afternoon, lunchtime slot, maybe an evening slot, and maybe a bedtime slot. We're really conscious of how medicine directions are relayed to people. And I know, and Aileen, you know, when working in a health profession, we might say take one 3 times a day. And you and I would understand that's every 8 hours because we want to spread something evenly across 24 hours. But most people would see that as breakfast, lunch, and dinner. So we want to make sure people are taking their medicines at the right time. So with that, we go through what time you need to take it. I could even put on the label, or the ladies pharmacists could put on the label, take one at 8 a.m., 12 p.m., 4 p.m., bedtime. Times like that, anything that we can do to make taking the medicine easier means that it's more likely to be taken. And the only medicine that works is the one that's taken properly. If a medicine isn't taken properly or not taken at all, it's going to be really ineffective. And the risk then is another cardiac event or just not being taken at all. So, or maybe perhaps side effects or toxicity if it's been taken incorrectly. And so I'd ask people to get familiar with their medicines that are prescribed for them, the name of them, why they're taking them, the dose, and how to take them. With medicine names, and you know how long the medicine names and complicated they can be, there's a lot of confusion goes on with medicines and their names. So every medicine has 2 names. Every medicine has proprietary names. So the most basic I could think of that we'd all know would be Panadol. And we all know the brand of Panadol or Calpol or those. But the actual drug, the medicine, the active ingredient, the thing that's going to do the job is paracetamol. So even all of the heart medications, they're the same. There might be brand, so people might know Lipitor, but actually we'll know it as atorvastatin. So just familiarizing yourself with the 2 names and knowing why the medicine, the active ingredient is the one that you're taking, not the brand. No, that is the strength. That's the drug that you need.
So for this lady, Kathy, you know, you mentioned putting the times on the label. Will that happen automatically, or is this something that she could ask her pharmacist to do?
It wouldn't be automatic because, again, we have to allow people their own independence. And I wouldn't want to offend someone by just assuming they wouldn't know what time to take their medicines. So I'd ask the pharmacist, if she's really finding it difficult, I'd ask her pharmacist, who's really approachable. We have the time and we have the computer equipment to do so, to just put the times that I need to do when I need to take my medicines. But still, she may then think, well, I've missed a dose. So what do I do at that point? If I've missed a dose and it's 3 o'clock in the afternoon and I miss my noon dose and I'm due another dose at 5, what do I do then? Pick up the phone and call the pharmacist. Some medicines are safe to take the dose as soon as you remember, and the next one as prescribed. And some we had to say that dose needs to be missed, and we'll go and continue as normal. So it just depends on what the medicine is, but always pick up the phone and ask the pharmacist.
Okay. And I think that's a really good piece of advice, that different people will have different needs. So some people will be happy enough to manage that, 8-hourly gap. That will totally confuse others, especially at the start. So give yourself a break. If this is all kind of new to you, seek the help of your pharmacist to get that extra information if you need it.
Even down to the most basic instruction of take one daily, that has lots of connotations with it. So someone can come home and say, well, it says in that box, it says take one daily. Is that before breakfast, after breakfast, in the middle of the morning? Is it nighttime? What if I only take it at nighttime? There's lots of questions, particularly if this is new for you. So absolutely, I would be very comfortable with anyone having the prescription dispensed, going home, having a think, and go, actually, even take one daily isn't as clear as I need it to be. So pick up the phone or come back into us. Pharmacies tend to be open longer hours than GP surgeries. We tend to be open maybe 10 or 12 hours in a day, and usually 6 days a week, if not Sundays as well. So we're really accessible at the end of a phone. We're all kind of a bit more IT savvy these days, particularly since the pandemic. So certainly a lot of pharmacies can be contacted through their social media pages or through emails either. So whatever way is easy to contact your pharmacy, give them a shout.
Yeah, great. Okay, so the next question, Kathy, is related to medication and its interaction with diet. So if people are on certain medications, they're worried that it's going to interact with not other medications, but rather things that they could eat. And I know grapefruit comes up a lot. If you could explain a little bit about that, and maybe if there's any other foods, or even if there's any other foods, myths about other foods interacting, if you could just give us some clarity on that.
I suppose that's a really good one, Aileen. It's worth remembering that an awful lot of medicines actually stemmed from plants. So we think back of the day, and you would know digoxin, and many of your black clients and patients will be on digoxin, and that actually comes from the plant foxglove. So, this is where we're going. A lot of these come from plants, but there are a lot of interactions. So some things are safe to take, some foods are safe to take with your medicines, and some I have to say, actually, I'm really sorry, we're going to have to cut that one out. And it's not from a kind of lack of joy sense. Sometimes actually it's from a safety point of view. But in terms of cardiac health and their diet, following a really healthy diet is really important. And there's not many medicines that say, there's not many healthy foods that you need to cut out altogether. Grapefruit juice is one, and it's not the juice itself that interacts with medicines, but actually grapefruit juice interferes with an enzyme. So something in the tummy that breaks down a lot of your medicines. Grapefruit juice actually stops that enzyme from working. And what happens then, the drug isn't broken down. And if the drug isn't broken down, then excess or higher amounts of the drug go into the bloodstream, and then you're at risk of side effects. So it does unfortunately interact with quite a few cardiac medicines. So statins, so many of your patients will be on cholesterol medicines, statins being the main one. It does interfere with many statins, some other cardiac medicines, so calcium channel blockers and warfarin, some of those. So grapefruit juice in small quantities might be okay. So, if you're having an evening and you want to have grapefruit juice for breakfast and you're night away, that's fine. But larger quantities, absolutely not. Other ones we know, people that are on warfarin might know about vitamin K, and maybe the dark green leafy veg. And oftentimes when they're going for, we don't have too many taking warfarin now. An awful lot of people are on the newer anticoagulants, which is great. But a lot of people on warfarin will know that if they have a lot of spinach, cabbage, broccoli, sometimes their INR levels, their bloods will be a little bit off. We'll see that maybe 5 to 7 days later. So sometimes I'll go, did you have avocado? Did you have some cabbage? And we can pinpoint something from a few days ago, and that's fine. But really, in terms of food, there's not a huge black and white list. So just check in with us.
Okay.
It's really important.
And Kathy, you mentioned grapefruit juice. Is fresh grapefruit itself, is that okay?
It is actually, yeah, absolutely fine. Absolutely fine. It's the juice itself that actually inhibits the enzyme from working.
Okay, so if I fancy a little bit of grapefruit through a salad, because that's something that I like, I'm okay with the actual grapefruit. It's
Yeah.
just the juice.
I suppose when we think about it, but if you're having the grapefruit, it's a smaller portion. Sometimes people tend to drink, a 200 or 300 liter or 200 or 300 mils glass,
Yeah,
and
which
that's a
could be
larger
2 or
quantity.
3 grapefruits,
Yeah,
essentially. Yeah, yeah.
exactly. So it's quite potent. So a lot of it comes down to it's not the item as such, it's maybe the quantity of the specifics.
Okay, okay, that's great. Um, a question from a member talking about medications. He likes to crush them because he has a difficulty with his swallow. And actually, another similar question came in. This lady just simply doesn't like the bigger tablets. It really, she gags when she takes them. So can all medications be crushed, Kathy?
You've actually they're questions that I would receive almost daily into the pharmacy. Because people sometimes when we have a really difficult swallow, not just because of maybe a cardiac event or a stroke, and they just actually can't swallow tablets or capsules. Before we go about crushing tablets, let's look and see the reason why. And if it's difficulty in swallowing, perhaps we can go to a smaller tablet. Perhaps the particular tablet has a coating on it that makes someone gag. So maybe there's a different brand. So I spoke earlier about the two names. Maybe there's a different brand of that particular medicine we can try. I have one patient who uses amlodipine, and a lot of your members will know amlodipine for their blood pressure. And she finds that there's one brand in particular, and the 10 milligrams she cannot swallow. So I get another brand in fives. She takes 2 5s every morning. They're smaller. And I've taken tablets out and I've shown her the size. We felt the texture and we go, right, let's try this and see. In terms of crushing, it's not many tablets are great tablets. And they're designed of maybe the muslin that you put over a jam jar. And gradually over 24 hours or over 12 hours, depending on the medicine, that medicine is released through that little membrane. You crush the tablet, all of the tablet is instantly released. All of the medicine is instantly released. So you can actually experience significant toxic effects, significant side effects early on, and then you lose any beneficial effects as the day progresses. So crushing tablets certainly generally isn't recommended. Some tablets, we can cut them, and depending on a dose, the pharmacy will often cut them for you. People often have, particularly stroke patients, might have dexterity problems. So maybe handling tablets, trying to punch tablets out. And the last thing they need is their pharmacist saying to them, go and take half a tablet a day as well. Because I know as soon as you try to cut that at home, scouts across the kitchen or the table or whatever, and it's lost. So we would really often cut tablets in half for patients. I put them in a jar and I'll say half tablet daily, 1 piece. So they know that what is in there is necessary. So chat to the pharmacist and see which medicines are safe for crushing. Very few are, and which ones are suitable for breaking or cutting in half. Some are. And can the pharmacist do that for you? Other things would be in terms of as we said, the swallow. Perhaps it's the brand of medicine. Perhaps I have actually one patient who is allergic, actually quite significantly allergic to capsules, to the plastic that is in a capsule. So his medicines, I always ensure I get a solid form, a tablet form, because he can't use that. Well, consequently, other people that have a difficulty swallow, perhaps that medicine can come in a capsule, and I could open the capsule and they could put it onto a spoon and take the pellets that way. So there's actually ways around most medicines that we can help with.
Okay, so you just problem solving with your pharmacist. Yeah.
Yeah.
So if you have a problem, speak up. Speak to
Mm-hmm.
your pharmacist because they're more likely to know the different brands, what the tablet looks like, what the tablet feels like, if there's a soluble version, if there's a capsule version, like you said, a smaller version, whatever it is. So the pharmacist would be the go-to there. So it'd be the same ingredient, like the paracetamol analogy, but it would just be a different kind of it's like the same car, but just a different brand, different outer body. Yeah.
What way can we make it easier? It all comes back to easier that we make it to take the medicine, the more likely it's going to be taken. What I would say is don't stop taking them because I can't swallow them or because I can no longer crush them. Just check and see what's safe and what we can do for you.
Yeah, brilliant, brilliant. Another question. This is from a gentleman, and he was saying that his doctor is constantly changing his medications. This gentleman is quite recent after his new cardiac diagnosis, so it's in the last year. So I'm guessing that this is quite normal. Just so people know, it is really normal that your medications will be changed quite a lot, especially in the initial phases. And this can be really confusing for people. And this gentleman has said he's really confused. He never knows what he's on. He never knows the dose that he's on. And he feels like a little bit powerless, I suppose, in all of that. Do you have any tips for somebody who's feeling like that, Kathy?
Absolutely. You're right. It does happen very frequently, particularly when we're trying to get people stabilized and get everything just to a steady state. It happens usually in the first kind of 6 weeks to 6 months following diagnosis or event. So really with everything, whatever's happening, come to your pharmacist, we go, why has this been changed? Why has my strength increased? Why has the drug changed altogether? Were you having a side effect that perhaps was me making a tablet not suitable for you, or was it not effective? Why has it been changed? We try and understand the why. Then we go, okay, we can figure that one out. Then I'd also encourage people to have a medicines list. So we keep that at home. We normally keep it in the fridge because most people have a fridge in the house. We'll either keep it in the fridge or on the fridge. And in that list, we'll have a list of our tablets, the date they're started, maybe the date they're discontinued if necessary, and what they're for. So at least then you know, once there's a bit more education around medicines, people are more, and when you understand more about them, you're more likely to take them. The chopping and changing can be really difficult to stomach, and it's really hard. You can feel absolutely powerless. So anything that's changed, bring back to us, because what we don't need is a rake of medicines and you're not really sure which one is my new one, which one is my old one, what strength am I to discontinue. So bring them back to the pharmacy, we'll dispose of them safely, and then you'll know where you're at. Oftentimes when people chop and change tablets, they'll come into me and they'll say, well, I'm going to run out of that one next week, but my new one I won't run out of until the week after. And it gets really, really confusing. So those dosette trays, those little medicine trays I spoke about at the start, are really useful for that. But also, in terms of brands of medicine, as we talked about, there can be a lot of chopping and change at pharmacy level, and we have to hold our hands up and say that, because supply into Ireland for medicines is really, really difficult right now and has been for about 2-3 years. So you might be on a little white tablet, might be pure fluid tablet, and actually I can't get that brand this month or last month or next month, and I might have to switch you to another tablet, which is the same active ingredient, same drug, but actually could be a different color, could be a different shape. So not only is there confusion at doctor level when the doctor's changing your medicines, but also I'm giving you something that looks and feels different what you had the month before. So any confusion at all, check with the pharmacist. We have to make sure that you are happy and satisfied leaving the pharmacy, that I know what to take, how to take, and why I'm taking it, because with all of that, you're more likely to stick with it.
Yeah, I think the key there, Kathy, is bringing in the old medications. I think it's when you've lots of medications at home and then you're like, oh my gosh, was this one stopped? Or that's a 20, but I think I'm taking 40 now. But I'm not sure because there's a 40 box there. Am I supposed to be taking 60? So I think when something is changed, bring everything into the pharmacy and let them help you kind of figure it out. And that list that you spoke about, Kathy, can that list be printed off in the pharmacy?
Yeah, we often print off patients' records, because don't forget, whatever's in the pharmacy is your data. Whatever's in the GP is it's your information. You're absolutely within your rights to go in and say, can I have my list of my medicines from the GP, from the pharmacy? Absolutely. If you were to end up in A&E, the nurse that will attend to you first will nearly always ring to say, actually, can you give me the most recent to-date list for that patient? There's also another list that you can download, print, or the pharmacy can do it for you, and it's on www.safermeds.ie. And this is an initiative with the HSE, with the literacy agencies, and with Irish Pharmacy to make sure that actually you can print off that list, keep it up to date. Some people keep it within their wallet, some people keep it, that they carry a copy, keep it on their fridge, keep it up to date. Most pharmacies have a facility now where we scan onto a patient's record. So if a patient has perhaps been with their cardiologist or been in A&E or been in hospital for some reason and a medicine changes, we will scan that onto the record. So I can then go to the GP. They might not always have the most accurate or the most up-to-date information.
Yeah.
All of the computer systems, unfortunately, don't speak to each other. So the hospitals information takes a little bit of time to go to the GP practice. Nothing connects in with the pharmacies, but so nothing is connected. So We try and scan as much onto our patient records. We have the most up-to-date, the most clear picture that we can. So if you came to me and to say, yeah, that 20 was changed to 40, is it to be together? You can email the GP very quickly, go, let me just verify, let me confirm exactly what this patient needs to be taking, and can we get that in writing, please?
Okay, great. Yeah, that's great. There were loads of questions on this one. So this is about having like a common cold, and maybe an allergy, or they've read an article about a supplement and people are on other medications, and maybe the supplement is only available in like health food stores or whatever, or maybe they're kind of on the fly and they're just thinking maybe they're away, for example, they're on holidays, and they have a bit of a sniffle or an allergy to something. If somebody is picking up an over-the-counter medication or a supplement, what are kind of the top tips there?
First and foremost is having that medication list, because cardiac medicines are probably the biggest culprit of interactions for cough and cold remedies, for some multivitamins. So to make sure that you have that medication list, and if you're not within your regular pharmacy, to present to whatever pharmacy or health food store that you're in, actually, this is what I'm taking. The health food stores won't really know the interactions. So before you even go and buy something, come into the pharmacy and say, I'm thinking of trying this, say perhaps a supplement, maybe ginseng, for example. And people might know as that give you a little bit of energy. But anyone that's on any antihypertensives or any blood pressure medicines, I'd absolutely no to ginseng. So it's really important actually before you buy it to come in and even check with your own pharmacy. But you're right, being away can be a big problem too. And sometimes people want to get medicines when they're away, perhaps they run out. They're not always dose equivalent. And we're coming into season, I'll often get pharmacies from different parts of Europe that will contact us to say, we've got a patient of yours here. Can we just verify their medicines list? Can we verify the drug that they're on and the strength that they're on? Not every drug is available in every country. So we have to make sure. So I'd always recommend with people going, make sure you have your prescription medicine with you. You might want to take a week's supply in your carry-on luggage, and maybe a week's supply if you're checking medicines into the hold as well. So that, but then if you're purchasing anything, whether it's over the counter, whether it's a cough and cold remedy, whether it's an antihistamine, vitamin supplement, whatever it is, always just check and see, is it safe?
Okay, that's good. Especially coming into holiday season, just make sure you're organized. I think it's part of you'd have the sun cream ready to go, and all of the summer clothes. Just make sure you have the medication and enough of it, plus some in the event.
In separate bags.
Yeah, in the event that, I don't know, there's a cancelled flight, or you're not bringing it too close to the margins. Okay.
Or the baggage goes missing. Exactly.
Oh gosh, yeah, that's the last thing we want. So what if somebody runs out of medication just in general? So they're at home and maybe they can't get to the pharmacy today, and they can't maybe get for the next couple of days. So they've run out of medication. Or we get a lot of the times people, and you have already kind of touched on this, if they forget to take a medication for, a couple of hours or a couple of days. What are the kind of tips in dealing with those scenarios, or maybe preventing that happening in the first place?
I suppose that's it. And it takes, especially if you've gone from having very, very few medicines or just been on statin and aspirin, then to having maybe 6 or 7 medicines to take, and if they're running out at different times. So firstly, we would say try and get the medicines to run out at the same time, maybe the same week, so you're not leaving short or leaving yourself short of one. Most medicines come packed in 28-day packs. And I know this is a little bit of a bugbear, but people will say to me, there's very few months just have only 28 days in them. Effectively, the way we work with it is there's almost 13 months in the year when we go on the 28-day pack. The reason they're packed in 28 is because most tablets have on the foil strip the days of the month or the days of the week printed, and it's just to help with that compliance or helping you adhere or stick to what's prescribed. But it does happen. It might be that actually, I intended to order that prescription and it hasn't come through, and I haven't been on to the GP, or my appointment with the cardiologist has been cancelled or delayed. These things happen. What's really important is that we try to avoid interruption. So we try to avoid days where you're not taking anything. Pharmacy is by law allowed to give you an emergency supply. So we were pre-COVID, we were allowed to give up to 5 days on emergency supply. But since then, we can give a month with it. We can give 10 days with it being a safe and stable medicine. And we can even extend, if it's all very safe and stable, we can extend the prescription from 6 months to 9 months if we deem it necessary and appropriate. If everything is fine, that's okay. Don't really, month 6 is up. I haven't ordered my repeat prescription. What am I going to do? I'll forget about it. I'll ring the doctor tomorrow. Tomorrow comes and passes. So don't be without the medicine. What we don't need is a sudden cardiac event
Yeah.
because you were on tablets. So we'll always give emergency supplies. And sometimes the GP, they're under pressure. They, depending on your practice, the GP or your consultant might ask for 48 hours notice before they send the prescription to the pharmacy. So just be aware of that. I'd always ask patients if you have a week left, or even when you start, if they have a dosette tray, say they're going to fill it up on a Sunday night and this is the last week, then phone on Monday morning, set a reminder. Actually, I'll need my prescription by the end of the week. But life happens. Things are busy. People, forget, and that's okay. But the most important is try and make sure you have the tablets at home. We can always chase the paperwork afterwards.
Yeah, great. That's good to know. So you can get your emergency supply. There's no need to be without. Yeah, okay. There was a question from a carer who picks up the medication for their spouse. But previously the spouse used to collect medication and he was very on top of it. And she has been doing it recently, and she kind of feels, again, just that it's a little bit out of her control or out of her comfort zone, I suppose. She's just going in and saying, repeat prescription, please. And that's kind of all she knows. Is that okay? Or
That's
what
okay.
kind of should she think about?
Once we have consent from the patient that we can discuss the medicines with the representative, we can absolutely sit down and I could bring her into the consultation room and go through step by step any questions that she has. We always want to make sure that it's medicines for the right person, that it's the right dose, and it's the right time. So make sure that she might have things to do, or again, that kind of, there's a little bit of an onerous position on people to say, right, I'm now responsible for this person's health. But actually, maybe a dosette tray, perhaps the pharmacy could do blister packing for her. There might be ways around making things easier. Because not only if they're not able to manage their medicines, the patient themselves, there are other things that she has to do as a carer. And caring is a very, very, very difficult task. So anything that we can do to make that easier. Some pharmacies may have delivery service. Perhaps that patient can't make it into or the representative can't make it into the pharmacy. Perhaps the pharmacy will deliver for them. Perhaps we need to get onto the GP. What can we do to make it easier that she can effectively dish out the medicines?
So again, Kathy, it's about talking, telling somebody that you have this concern or problem, because there's probably something that can be done to relieve that worry or anxiety. Okay. You just mentioned a blister pack there, Kathy. What is a blister pack?
So the dosette trays that we can purchase in the pharmacy, the patient usually fills up at home, and they're unmarked, and oftentimes they have a little day compartment that can come out. If you're going out for the day, you can take that one day with you. Blister pack is a service that some pharmacies operate for patients that really have difficulty managing their medicines. So we would fill them up within the pharmacy. There's usually a sheet attached that has a pictogram of the tablet, the capsule, or whatever it is, directions and the name and strength. So if a patient needs to go into hospital, they usually bring that pack with them. It can be helpful when people have found compliance or remembering the tablet a challenge. So they can be useful, but also it means that the tablet is out of the physical pack, and some people prefer to know at home, this white tablet, that's my bisoprolol, that's what I know. So it just depends on what suits, and we want to make sure we don't really offer it if we think someone is independent and able to manage their medicines. But if they're not able to manage their medicines, absolutely, we can step in there. So it's managing that, people need to maintain their own independence and their own care of their own health and their ownership of their own health. But actually, the best medicine is the one that's taken appropriately and safely.
Yeah, okay. So blister packing isn't for everybody. It's only if you can't manage it at home. Even if it's a challenge, you should try and manage it as much as you can, just to get to know your medications and kind of be on top of it, be in control of it. Yes, I understand that. That's a good tip. The final question, Kathy, is around paying for the medications. So again, people are often on nothing before their event or very little. And sometimes then, if they don't have a medical card and the cost of the medications isn't covered, it can be quite a fright. And understandably, and it's often at a time when people are out of work, and it can be just a real added stress at a time where you have enough going on. So is there anything that we can do in relation to that, or how do people manage it?
So I suppose the first instance is to check in and see, and the medical card is means tested, and there's quite a low threshold. So it's difficult enough to get the medical card, and we can appreciate that. But perhaps I would say apply for it anyway, and you may be able to get a GP visit card depending on your own means test, your own circumstances. The next thing then we would do is check the cost of the medicines. So check and make sure actually is there a generic available. So like we talked at the very start about the two names for a tablet, there might be a brand name, which is the original brand that was launched onto the market. But when that patent or the copyright runs out of a medicine, there are generics available and they're usually much more cost effective. So check and see, are there generics available that I can use to bring the cost of my medicines down? Then thirdly, the drug payment scheme can be a really good safety net or a really good threshold for people. The current payment is €80 and you only pay €80 if you reach 80 or above. So we encourage people, if you don't have a medical card, be registered for the drug payment scheme anyway. If your medicine is only just tipping along at 10 or €12 a month, it's fine. But if something happens and suddenly you are prescribed one of the neuro anticoagulants, which are really expensive, you're almost guaranteed to go over €80. So at least then that's in place. And with that, if it comes to 150, if it comes to 300, 80 is the maximum that will be charged. That can be done on an emergency basis. So like you say, somebody might be coming out of the hospital with this really long list, not really sure what's going on, and then worried about the cost of the medicines. And that cost can sometimes be prohibitive. It might be a barrier to people taking their medicines. And we want to make sure that we try and address that as best we can. So the drug payment scheme, if a medical card isn't suitable, drug payment scheme is the next best thing. Not all medicines are that expensive, and a lot of blood pressure tablets, cholesterol tablets, and aspirin are really, really costly. They're really low in price. You know, maybe 10 years ago, they would have been quite expensive, but medicine prices in Ireland have been dropping for about 10, 12 years. And we're one of the lowest prices in Europe now. So it's a good thing. Other thing people should know is if they have a diagnosis of diabetes, anyone that has had diagnosis of diabetes and has maybe a long-term illness card for their diabetes, then aspirin, cholesterol, blood pressure medication is also covered on that long-term illness card. So just make sure that you're aware of that, because being diabetic, you're at higher risk of developing any cardiac issues. So it's seen as like kind of secondary prevention. It's seen that actually, let's try and tackle this. So to try and encourage people to stick with that treatment, it is available free of charge on the long-term illness scheme if there's a diagnosis of diabetes.
And for the drug payment scheme, Kathy, where do they get the application form for that? Or can it be done in the pharmacy for them? Is it a hassle?
No, it's not a hassle. So the application form, I suppose, we've gone so IT these days, Aileen, everything is online. So just going on to myphse.ie and you can actually create your own portal. And I know for some people this can be a real challenge as well. So we're very aware of that. But if it's a very quick and urgent thing, we can do an emergency registration, which will be valid for 12 weeks. And that gives people the time to actually then, I can emergency register one patient, get that covered, and then they have 12 weeks to go and put the rest of the family or anybody else that they share the household with on the drug payment scheme. €80, I should have said, actually, the €80 is for the household of perhaps a husband and a wife, and or any dependent children they may have. So you have someone in their 40s who perhaps has had a cardiac event, but they've got young kids as well who maybe one is asthmatic, maybe their wife is on medicine. So that €80 is usually per household. If there are people living in a household that are over 23 and not in full-time education, they will be classed as independent. So it's anyone, spouse, partner, and dependents.
Okay, that's great to know, Kathy. I think what I take from today is that, your pharmacist is a really valuable resource, and it's somebody who's available to you in your community. You'll generally know what they look like. You don't have to make an appointment. Like you said, you can pick up the phone. A lot of people can walk down to their pharmacy because they're in most, even rural villages now, like yourself, Kathy, where you can really access somebody without kind of waiting days for an appointment. And I think for people to understand that their question would probably not be unique. They're probably feeling like lots of other people have felt. So use your pharmacist, open up, ask those questions, and you will feel better about your medications once you understand them more.
By law, all pharmacies must have a consultation room that is visually and audibly private. So there is a private space that you can go in. I would multiple times a week have someone come in with their bag of medicines and say, talk me through what all of this is for. And absolutely, we will have the time, the skill, and the expertise really to go through that with people. So that's exactly what we do.
Yeah, so if you're that person that's in that situation, you've just had your cardiac event, you feel a little bit overwhelmed with this, use the resource of your pharmacist. Get to know your pharmacist so that you can get on top of it. If you understand your medications, why you're taking them a little bit more, you're more likely to take them, you're more likely to be comfortable taking them, and therefore you're more likely to have better quality of life and better outcomes in relation to your health. Kathy, thanks so much for today. Myself and Kathy are going to be back on another day with a chat about anxieties around medications. So please keep an eye out for that. And if you have any questions, you can just post them in the comments underneath, and we'll endeavour to get back to you. You can also call the nurse line at any stage, and the nurse line is on 016685001. If you do have a specific question in relation to a medication you're on, you are welcome to do that as well. Guys, thanks for listening. Kathy, thank you so much. We really appreciate your time, and we'll see you for the next talk. Bye, everyone.